Today, the light at the end of the COVID tunnel came into sharp focus. Yay! Thousands of frontline workers in every state and territory began receiving the first dose of the COVID vaccine.
We're no longer acting defensively against this, we're actually on the offensive, and it's an amazing day.
Painless, didn't feel a thing.
Phase 1 of the vaccine rollout includes quarantine, border and frontline health workers, the elderly and those with underlying conditions. Then it's a tiered rollout, prioritising critical workers, Aboriginal and Torres Strait Islanders, older Australians, then all adults over 16 by October.
We know that around the world this pandemic continues, and so we have to ensure that we take every step to continue our containment. Our COVID-safe measures remain equally important. Please keep being tested.
But with the vaccinations comes a new danger. Scammers.
What we're seeing overseas is text messages and emails that are being sent to people wanting to confirm their details or try and incentivise them to share information in a way that will lead to identity theft or fraud against their bank accounts.
Thousands of vaccine-related domains have been registered over the past few weeks, and experts are warning people to be on the lookout.
Unsolicited phone calls, text messages or emails that ask them to register for the vaccination program, looking to confirm details of an upcoming appointment and any request for payment or personal information.
Another reminder that we can't let our guards down, even as we start the slow journey back to normality.
Ready for victory. Deputy Chief Medical Officer Michael Kidd joins us now. Michael, how do we know when we're in an eligible group and it's our turn to get the vaccine? Like, do we get a text that tells us, or do we just decide that we're in the right group and book in?
Yes, so no, you can't. You won't be able to book in until you actually meet the eligibility criteria for the cohort of people who are receiving the vaccine at this time. And but we'll be letting people know which groups that we're moving through programs like this, through the widespread media, through social media. And also, of course, in the next 4 to 6 weeks, we're going to start rolling the vaccine out through general practices right across Australia. And GPs will be reaching out to their patients who fall in the categories which are going to be vaccinated as well. So there'll be lots of ways for people to find out. Nobody's going to miss out. Everybody who wants to get this vaccine is going to be able to get it, and it's free of charge.
Michael, your smile is a little wider today. You always got a smile on your face, but today you seem a little happier. It's a big day for you, isn't it? We've spoken to you lots about the vaccine over the last year. It must feel good to finally have it here.
It's just extraordinary, Carrie. It's such a milestone in our battle against COVID-19 to see these vaccines start to roll out. If you'd asked me a year ago whether we would be rolling out a vaccine against COVID-19 now, I would have said, you're crazy. We've never seen vaccines develop that quickly anywhere in the world. There's been an extraordinary effort, and I think we all should be grateful to the amazing researchers in Australia and around the world who've developed these vaccines so quickly, but also to everybody who's behind the logistics of getting these vaccines into the country and distributed right across the country so that people can start to get protected against this awful infectious disease.
Well, someone who does have a bit of doubt about one of the vaccines is Norman Swan, who warned today that because the AstraZeneca vaccine is pretty much useless against the South African variant, what will that mean for opening borders, whether that's actually going to be something that's possible? Would you agree with that?
Well, we don't yet know the effectiveness of each of the vaccines which has been released so far against these new variants which are starting to appear around the world. So there's a lot of research which needs to be carried out, and of course we're seeing some of this happening in real life. There's been 170 million people around the world who've already received a first dose of one of these COVID-19 vaccines. So we're able to follow and see what's happening with those people and whether they are still contracting COVID-19, even if they're asymptomatic, but able to transmit to other people. So there's still a lot of things that we're learning. But what we do know is these vaccines are very effective in preventing severe disease in people who are immunised. And what we also know is that the quicker we can vaccinate people right around the world, the quicker we can stop the spread of COVID-19, the quicker we can prevent the development of these variants of the COVID-19 virus from occurring.
Pricey, you were pretty strong about this in an article you wrote last week, that you think people should be able to go to the footy, go on planes, do anything like that unless they've been vaccinated.
Yes, and the reaction to that really, Carrie, was quite surprising. I mean, I was
I was insulted uphill and down Dale by people who are obviously against vaccination. So there's still a lot of emotion out there within the community. And you and I were talking about this earlier today, that you know a lot of people who say that they don't want to do it.
Well, I'm interested, Michael, if the uptake isn't there, and you do need a huge amount of the population to get vaccinated, can you see a day where it is compulsory, or where there's a kind of no jab, no play type policy in place to get more people vaccinated if they don't come on board?
So I think it's early in the day to be talking about people not being able to do things unless they've been vaccinated. We've got to wait until we've had the opportunity to vaccinate the entire population before we have those discussions.
Michael, last night on the show, we showed a bar in Israel where they were giving out a free beer with each vaccination. Would we think about doing some of that? Like, we saw footage of people who looked like they'd been vaccinated 10, 12 times.
Yeah, okay. I think what we've got in Australia, let's just let people go out and get the vaccine. They know they're doing it to protect themselves, protect their loved ones, and to protect everyone else in our wonderful country.
Can we at least have a celebratory beer afterwards?
You can do whatever you like after you've had your vaccine.
I think you'll be having one before, after, and during, to be honest, Tommy.
Yeah, you've been celebrating since before the pandemic. That's very
I was just excited for the vaccine to come.
Michael, thank you very much for speaking to us on a really, really important day.
Thanks, everybody.
Incredible when you think back to March last year. If someone had said to you, oh yeah, there'll be a vaccine, it'll be all approved and tested and ready to go by February next year, you wouldn't have believed them. You just wouldn't have believed. Remember all the experts who were saying, oh, it's going to take 2 years, 3 years? It feels like today we might have just jumped over that last hurdle, don't you think?
You know, it's interesting too. I wonder those people that don't want the vaccine, how they would have felt like a year ago if they knew we could possibly get a vaccine, whether the year's experience and things not being as panicked here in Australia now has changed the feeling of we need this vaccine.
Yeah.
Do you know what I mean?
Or if that vaccine had arrived in a year from now or 2 years from now and they had to go 3 years living with this, whether that would change their attitudes,
Right, we've got to take a break though. We'll see you on the other side.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.